You get a diagnosis, a prescription, and maybe a photocopied diet sheet. Then you are sent home to figure out the recovery process completely alone. The traditional medical setup waits for the machinery to break down. You end up navigating a fragmented system that focuses on suppressing the symptoms of a disease you already have, rather than repairing the body itself. To actually build health, we have to flip the timeline. We need a proactive scientific framework that prevents the collapse instead of just managing the fallout. That specific approach is the foundation of the culinary nutrition human development system. Instead of bouncing you between isolated specialists who never speak to one another, this framework builds a single, integrated team acting in total synchronization. If a medical model only zeroes out your symptoms without restoring your physical and mental baseline, a relapse is mathematically inevitable. You haven't rebuilt the structure, you've just patched a leak. The operational platform that drives this team is called Prime Chef & Co. Think of it as a central care navigator orchestrating 5 distinct experts around a single patient. The doctor handles clinical safety and risk classification. Next, the nutritionist maps your biological requirements using medical nutrition therapy. But medicine usually stalls here, leaving you with zero practical kitchen capability. This gap requires a translation engine. Enter the culinary nutrition chef. They take rigid, intimidating dietary prescriptions and convert them into realistic daily recipes, grocery lists, and actual cooking techniques. Healthy eating stops being a logistical nightmare. Because without someone to physically translate a spreadsheet of macronutrients into a meal you actually want to eat, clinical data stays locked on the page. To ensure new meals stick, the psychologist focuses on behavioral health and adherence science. Without managing stress or emotional eating patterns, meal plans unravel. Finally, the trainer physically applies your medical profile, guiding you through fitness, rehab, or mind-body tracks to restore physical balance. When all these pieces are in place, we can accurately define food as medicine. It is an evidence-informed tool designed to accelerate your treatment and reduce future risks. It does not replace your clinical drugs. It makes the healing process highly efficient. That concept only functions in reality because these 5 specific experts are constantly passing data in a closed loop, turning a doctor's diagnosis into a chef's recipe and a trainer's workout program. If you try to cure systemic health problems with nutrition alone while ignoring physical movement and the psychology of habit, the effort falls apart. This entire framework is built on a strict 12-week timeline, specifically because the goal is to get you out of the system. Phase 1 covers weeks 1 through 4. This is the foundation stage. The team synthesizes all their diagnostics into a single, cohesive human development prescription. Weeks 5 through 8 are dedicated to skill development. You take that blueprint into the kitchen and the gym, actively learning the practical habits you need to survive on your own. By Phase 3, weeks 9 through 12, you enter the independence stage. The team hands you a long-term maintenance plan and the support structure step back. You transition from a passive patient reliant on the medical system into an autonomous individual dictating your own health trajectory. True health is the peak of your physical, mental, and social capability, and you only reach that peak when clinical science is successfully translated into the practical reality of your daily life.